Hey there, future CNAs. Ready to level up your skills and confidence? This video is just the beginning. We have even more CNA practice tests and lessons waiting for you, and the best part, it's completely free. So check it out. Now let's get started.
Question 1. The CNA is assisting a client to shower. Which of the following should be completed prior to bringing the client into the shower? A. Test the water temperature. B. Apply skin lotion to the client's heels and bottoms of feet to soften calluses. C. Have the client take off their clothes and wrap them in a blanket for the trip down the unit hallway. D. Turn the water to the hottest setting. The correct answer is A. Test the water temperature. Water temperature should be tested prior to the client entering the shower. Water that is too hot may present a safety hazard and burn the client. Water that is too cold may be uncomfortable. Putting lotion on the bottom of feet prior to shower entry can present a fall risk. Client privacy should be maintained prior to entering the shower. Question 2. A CNA is assigned a task for which they feel they have not been adequately trained. What should the CNA do? A. Inform the nurse that they have not received appropriate training to complete the task. B. Swap tasks with another CNA. C. Research the task in the textbooks at the staff station, then complete the task. D. Ask the client how the task is usually performed. The correct answer is A. Inform the nurse that they have not received appropriate training to complete the task. Client and staff safety is enhanced when staff receive necessary training prior to completion of tasks. The CNA should inform the nurse regarding the status of training for the activities assigned. Question 3. Which of the following pulses can be checked by placing 2 fingers flat against the inner aspect of the wrist? A. Brachial. B. Apical. C. Carotid. D. Radial. The correct answer is D. Radial. The radial pulse is checked by placing 2 fingers flat against the inner aspect of the wrist. The apical pulse is found at the point of maximal impulse on the chest. The carotid is found at the neck. The brachial is found at the elbow. Question 4. Which of the following should be used to provide safety when ambulating a client? A. Slide-on slippers. B. Skid-resistant socks. C. Bare feet. D. Cloth socks. The correct answer is B. Skid-resistant socks. Falls are a leading cause of injury. Non-skin or skid-resistant socks are preferred to slide on slippers, bare feet, or cloth socks to prevent falls. Question 5. The plan of care for a client includes the instructions to assist the client to ambulate in hallway TID. Which of the following would correctly represent the timing of this intervention? A. 3 a.m. and 3 p.m. B. 8 a.m. and 8 p.m. C. 8 a.m., 12 p.m., 6 p.m., and 10 p.m. D. 10 a.m., 2 p.m., and 6 p.m. The correct answer is D. 10 a.m., 2 p.m., and 6 p.m. TID is an abbreviation for 3 times a day. Assisting the client to ambulate at 10 a.m., 2 p.m., and 6 p.m. represents 3 times a day. Question 6. The CNA is caring for a client who is experiencing an infection with Clostridium difficile, CDIFF. Which of the following should be used when caring for this client? A. Gown and gloves. B. Gown, gloves, and N95 respirator. C. Gown, gloves, surgical mask, and face shield. D. Gloves and surgical mask. The correct answer is A. Gown and gloves. C. diff is spread through contact with infected feces. A gown and gloves should be utilized when caring for this client. Question 7. The CNA is providing a back rub to a client as part of evening care. Which of the following should be included in the correct technique for this intervention? A. Use deep, short strokes. B. Heat the lotion or oil until it is hot. C. Use a light circular motion on skin over bony prominences. D. Chill the lotion. Oil in the freezer. The correct answer is C. Use a light circular motion on skin over bony prominences. Skin over bony prominences requires special attention to prevent injury. Question 8. Which of the following should be used when the CNA is shaving a client who has diabetes? A. Single-edge safety razor. B. Surgical prep razor. C. Electric razor. D. Double-blade safety razor. The correct answer is C. Electric razor. Diabetic patients are at increased risk for infection. Use of an electric razor provides additional safety with less risk for cutting the skin. Question 9. When can physical restraints be used with a client? A. When there is imminent danger of self-harm to the client. B. When there is not enough staff to sit with the client. C. When the client is agitated due to pain. D. When the CNA feels it would be helpful. The correct answer is A. When there is imminent danger of self-harm to the client. Restraints may only be utilized when they are ordered, and there is an imminent danger of harm to the client if they are not used. They may never be used in place of staffing or for staff convenience. Question 10. The CNA is monitoring breakfast in the dining room when a client begins to turn blue and choke. What should the CNA do next? A. Use the Heimlich maneuver, but additional assistance is not needed. B. Pull the fire alarm to summon assistance. C. Give 5 strong blows to the client's back. D. Call for assistance and use the Heimlich maneuver. The correct answer is D. Call for assistance and use the Heimlich maneuver. The fire alarm should only be utilized for fires. Additional assistance should be summoned immediately and the Heimlich maneuver implemented. Question 11. The CNA is caring for a client who is on precautions for methicillin-resistant Staphylococcus aureus, MRSA. Which of the following precautions should the CNA utilize? A. Droplet precautions. B. Neutropenic precautions. C. Contact precautions. D. Respiratory precautions. The correct answer is C. Contact precautions. MRSA transmission is prevented through the use of contact precautions. Question 12. Which of the following is correct when providing perineal care to the male client? A. Wash the genital area after the rectum. B. Replace the foreskin after cleansing the uncircumcised penis. C. Clean the penis from the base to the tip. D. Rinse the washcloth after cleansing the rectal area. The correct answer is B. Replace the foreskin after cleansing the uncircumcised penis. The rectal area should be washed after the genitals. Replacing the foreskin of an uncircumcised penis is necessary to prevent injury. Question 13. Upon entering a room, the CNA finds a client who is not responsive. What should the CNA do next? A. Telephone the family contact. B. Close the curtain around the bed to maintain privacy. C. Call for help. D. Page the doctor on call. The correct answer is C. Call for help. Assistance should be summoned immediately when a client is discovered to be unresponsive. Question 14. The CNA is assisting a client when a red rash is noted on their groin area. What should the CNA do? A. Apply a cornstarch powder. B. Apply a moisturizing skin lotion. C. Ask the family what they would like applied to the rash. D. Notify the nurse. The correct answer is D. Notify the nurse. This rash should be assessed prior to application of any powders, lotions, or treatments. The nurse should be notified. Question 15. The CNA has completed evening care for a client who wears hearing aids. What should be done with the hearing aids when they are not in use at nighttime? A. Place on bedside stand with battery removed. B. Place in bedside stand drawer. C. Leave in place on the client. D. Place in the client's morning care basket. The correct answer is A. Place on bedside stand with battery removed. Removal of the battery when hearing aids are not in use extends battery life. Question 16. The CNA has completed evening care for a client who wears dentures. Where should the dentures be placed for the night? A. On the bedside stand. B. On the sink in the bathroom. C. On the dinner tray. D. In a cup with the client's name on it. The correct answer is D. In a cup with the client's name on it. Dentures should be stored in a denture cup with the client's name clearly visible. This will help to prevent lost items. Question 17. The CNA has completed morning care for a client. Where should the used linens be placed? A. On the floor of the client's bathroom. B. On a shook pad on the floor in the corner of the room. C. In the soiled linen hamper. D. In the clean utility room. The correct answer is C. In the soiled linen hamper. Soiled linens represent an infection control hazard and should be placed in the soiled linen hamper. The clean utility room is for clean, unused items. Used linens should not be stored in the clean utility area. Linens should not be left on the floor, as they would be a fall hazard. Question 18. The CNA is assisting a client who is unconscious with mouth care. Which of the following represents the position the client should be placed in for this procedure? A. High Fowlers. B. Prone. C. Supine. D. Lateral. The correct answer is D. Lateral. Clients who are unconscious should be placed on their side in the lateral position for mouth care. This position will assist to minimize aspiration of oral secretions and products used during the procedure. Question 19. The CNA is setting up items for a client so they may complete their morning care. The client has a paralyzed left arm due to a previous stroke. Where should the CNA place the comb for this client? A. In the client's left hand. B. On the client's right side. C. On the client's bedside table. D. In the client's bathroom. The correct answer is B. On the client's right side. Placement of the comb on the right side of the client will facilitate the client's ability to reach the item. Question 20. The CNA is assisting a client with foot care when bruises are noted on the bottoms of their feet. What should the CNA do next? A. Ask the client how they got there. B. Notify the nurse. C. Complete the foot care and apply non-skid socks. D. Make sure the client is scheduled for a foot soak tomorrow to increase comfort. The correct answer is B. Notify the nurse. Bruises on a client may be indicative of an abusive situation. The nurse should be notified.
Thank you for watching this video, and we hope it was helpful. Click the link right here to start your free 3-day trial to CNA Premium, which has over 1,000 practice questions that will help you pass your CNA exam on your first try.